Bill Barrett. I'm an orthopedic surgeon. I've been practicing orthopedics for over 30 years, specializing in hip and knee replacement surgery. So the way we approached introducing iovera into our practice was a bit of dipping your toe in the pond, so to speak. When I saw the results of this, I was actually very impressed, because once the treatment has been applied to a nerve, the change in that nerve is virtually instantaneous. And so you get immediate gratification, which is something most orthopedic surgeons want. You know, we went into this field because we're fairly black and white. We look at an x-ray, we can see it. A bone's broken, you fix it. You have a nerve, you treat it, it's numb for a period of time and the pain has gone away.
The way I describe it is that it is a freezing type technology in which we can find the nerves that are responsible for pain in and around their knee, and we can deliver localized freezing technology to those nerves so the nerves no longer communicate that pain from the knee to the brain. iovera has really changed the way I approach the discussion with the patient as we're talking about what it means to have a knee replacement and how we're going to manage their pain, because that is one of the #1 concerns that patients have. And so iovera has really provided us a solution to giving them up to 90 days of pain relief following their knee procedure, which can help them get through that painful rehab time. One of the things that brings me a lot of joy is when I can just watch fear just come off of a patient's face, when you've just shown them how you're going to be right alongside of them on this journey through a total joint replacement, and just the relief. And that's what I see with iovera. After the iovera treatment, to watch them stand up, a little bit doubtful still, but they stand up and suddenly it's relief, it's joy. And that has been an absolute delight to watch.
If somebody was interested in learning about iovera, I'd invite them to come see us and say, watch my physician assistant do this. Watch the interaction with the patient, see what it feels like, and then see the patient's experience after they have it.
It's a 90-second treatment, and they're instantly telling you that they can feel a sensation and just that sudden onset of pain relief.
It's fairly dramatic, and I think it's worthwhile to have people see that experience and see what the patient goes through.